inviting me here today. Well, my name is Dr. Elisabeth Aliseda. I was born in McAllen, Texas. My dad moved us to Beeville in 1974, and I've been here ever since. And then I went away to college, and then, I went to school to Austin Community College for my first 2 years. I transferred to the University of Houston, finished my bachelor's degree there, and then I continued my doctorate program in Puerto Rico in San Juan, graduated from there, and then returned to Beeville.
Okay.
I'm trying to adjust her microphone.
Okay.
If Anthony, I need your assistance, please. Anthony, something's wrong with her mic. Is her mic right here? Okay. Give her a test.
Test.
Okay.
Test.
Let me see. Looks okay. All right. Let's proceed.
Test. Good.
Is it too loud? Is it too loud? Closer?
Get a little closer.
Yeah. Is it too loud? Yeah,
Oh, it should be right there.
it comes down.
Okay.
We got a new unit that we're working with, and we have a little difficulty with it. That's okay. Dr. Aliseda, what inspired you to become an
optometrist?
ophthalmologist?
An optometrist.
Uh-huh.
So what inspired me is I was working in Austin for an optometrist. Didn't even know that was an option because I never needed glasses. I believe the first eye exam I ever had was Dr. Baker here in Beeville, long time ago downtown. And I remember I left because I wanted glasses. I was very upset because I didn't need them, so I didn't get glasses. But I started working for an optometrist, and it was very quickly where I realized I really liked what she did. And a lot of people had asked me, why didn't you go do the medical? Why didn't you go to medical school or do the medical program since you like helping people? And I really liked optometry. Optometry didn't require surgery. It didn't require ER. We don't really see blood. You know, it was a very clean profession, and that's why I chose that avenue. And as far as our schedule, it's also not as busy, and we can work however much we want or how little we want. So it was a comfortable profession for me at least.
Why did you decide to practice in Big County?
My parents, first of all.
Okay.
So my parents were already elderly, and I wanted to be closer to them. So from Puerto Rico, I made the move to Laredo. So I worked in Laredo. They offered me, they needed a bilingual doctor, and after 3 years of negotiating, I moved to Laredo. So I opened up the Walmart's, the Vision Center off of Bob Bullock in Laredo. I worked there for about 2 years, and then I just made my way to Beeville. And I didn't work right away. I did move into Beeville, but I didn't work in Beeville. I was working in Corpus. I was commuting. And so after years of commuting, I decided I'd come to Beeville. So I started to work for Dr. Baker.
Yeah.
I wasn't ready to put up a practice yet, and I just had too much. My kiddo was really young, which, by the way, I didn't mention that, but of course I'm married to Jose Aliseda. I got a 19-year-old son, Ryan Salinas, right? So that was part of my introduction. Sorry, sweetheart, I just got with my two guys in my life. But yeah, so when I decided to work in Beeville, it was because my son was in school, which I'll later kind of get into it. It was a lot of it had to do with the need that he had, the medical condition that he had that kind of drew me closer to home, where I had a network of people helping me with him. So yeah, that's basic. And helping the small community. You know, it's crazy because so many doctors don't want to move to the small towns. They don't. They choose to live in the big cities, and I get that. You know, there's resources in the bigger cities. But in Beeville, there's this charm. You get to, you know, Monday through Friday, we work. That's what we do. We don't go out. We work. We cook. We work out. You know, it's a small. And I try to tell anyone who's thinking about coming to Beeville, or a small town, to give it a shot. We need you here. You know, we're losing professionals, not just in the medical, but we're losing medical. We're losing lawyers, people don't want to come back to the small towns. I think it's very important to give back.
Yeah. What are the most common eye problems you see?
Common eye problems in South Texas would be diabetes, diabetic retinopathy, glaucoma, and cataracts. Those are the most common.
Yeah.
You know, for some of the people that don't know, Dr. Aliseda, I know her from way back because I was a good friend of her dad. And goes back to Texas trucking.
Texas trucking days,
Wow.
that's right.
Yes,
That's
my
right.
good friend Roy Perez.
Yes.
You know, a lot of people, they don't know you, but they do Roy
They know
Perez.
my dad.
Yeah. How important are an annual eye exam?
They're very important. They're very important because an eye exam, it's not just what you can see or what you can't see, it's why. Why can't you see? Sometimes it's a simple pair of glasses. It's a refraction problem, but it could also be other things related to the eye. Anything from cataracts, glaucoma, diabetes, you get cancer in the eye. So it's very important, even if you think you have good vision, to have an annual exam, get a dilated exam, or do fundus photos where they are able to see the back of the eye. And that's what we have in our office. We have this nice instrument called the Optos. It's an optomap. It takes a picture of the back of the eye, and you don't have to be dilated, and you're able to see exactly what you have, and I'm able to show the patient exactly what they have.
That's awesome.
Mhm.
How does diabetes affect your vision?
It affects it in many ways. Diabetes affects you can get diabetic retinopathy, which is the bleeding in the back of the eye. Usually when people start getting blood in the back of the eye, it's because they've had over 10 years of uncontrolled blood sugars. And that's when they start bleeding in the back. I can't tell if they're just starting or the A1C is just kind of, if you're borderline, I can't tell. But once I can tell, that means you've had it for a long time. Another thing it causes is cataracts. You can get early cataracts with diabetes.
Yes.
The lens swells, and it's like a big cloudy, dirty window in front of your eye. You just can't, glasses won't help.
That's correct.
And then the other one is glaucoma. Glaucoma also comes with diabetes. Diabetes causes sometimes misdirected blood vessels that start to grow in areas that they shouldn't. So the flow, the liquid, the aqueous humor that we have in our eye that flows, it blocks it. It creates blockages. That blockage creates elevated pressure in the eye.
Wow.
And that elevated pressure causes damage to the back of the eye, and over a period of time, the optic nerve gets damaged. And then that's what causes glaucoma. That's when your vision you start losing it from the periphery. You won't notice it. Glaucoma is the silent thief of sight.
Wow.
And how do you
Te roba la
treat
visión, huh?
that? How do you treat that?
The glaucoma, if we catch it in time, we start using drops. If it's drops, if it's something that needs to, sometimes they have to do this procedure called a PI. It's a laser procedure to open up the channels to let the flow go. It's like a plumbing problem. And so if that was needed, I don't do that. I would refer you to a specialist for that. But I do drops. I prescribe eye drops. Yes. But those are the three main things for diabetics, which is a lot of times patients don't even know they're diabetic.
Yes.
What happens is they don't go try to get their license, and they don't pass the screening, the vision screening. And that's the only reason they come to me, because they need to have that paper signed, right, the vision screening. And it's there that they realize, I show them the pictures, I'm like, well, you're diabetic, you have this, you need to go get this checked out. Because glasses won't help.
What advice do you have for senior citizens?
For senior citizens, what advice? Let's see, what do I have? Get your eyes checked every year too, of course. And a lot of times the question is cataract surgery. The question is, when do I get it? It's relative, right? Cataracts are the clouding of the lens, and the clouding is over a period of time. It's solar damage, right? It's sort of like the headlights in your car. So when they get real cloudy and you're not able to do the things that you want to do, they interfere with your living, you can't drive very well, can't see at night, well, I suggest to get it done. It's mind-blowing. Once they take that cataract out and they replace your lens, everything is really clear. And nowadays there's so many options that whenever they do put the lens in there, you'll have alternatives. Like, what kind of lens do you want in there? You can get a basic lens, which means you're still going to need glasses, but it'll be clear. Or you can get the next tier, which is a lens that allows you to see distance, but then you'll still need readers. Or nowadays you can get these light adaptable lenses, which are great. They put it, you can see far and near, and chances are you won't need any readers. Like, you'll see perfect everywhere. So it's a really, really good alternative. That one, I don't believe Medicare pays for, so I think that one's out of pocket. But man, if you have the money, it's worth it.
What about if you have high blood pressure? Does it affect it?
Also too, yes, the blood vessels, they become tortuous, we call this, the bending of blood vessels in the eye, and it can cause issues like that, blockages.
Doctor, what advice do you have for parents regarding children and eye health,
Well,
eye care?
usually it's when kids are gonna start school, you wanna get them an eye exam, a basic eye exam. Nowadays, they're very easy. I've actually examined 2 and 3-year-olds, but it really depends on the maturity of the 2 and 3-year-old, right? These children, most of the time it's 5 and up. Or if they're 4, it's because they know, they at least are able to recognize images and tell me what they see. Because we have instruments now that read the back of the eye, and I use simple lenses in front of them, and I can tell if they need glasses or not. Also too, as new parents or parents, you always look at your children's eyes. Look at the pupils, which is the little black hole in the middle, right? Look at their pupils, make sure that they're equal in size. Also, look for any discoloration of the pupil. If there's anything white in the pupil, you want to definitely seek attention. Or if you see an eye turn, you want to address all those issues early on.
What role does the community service play in your life?
It plays a big part, because I always feel giving back is very important. So I was in the Rotary for a while. Right now I'm a member of the Pan American Club. I was in other clubs before I lost my mom, but I had to resign. I had to resign because she required a lot of my attention. But now that she has passed and I have a little bit more time, I am looking to join more clubs and do more in the community.
That's wonderful.
You just point on the technology. How has technology changed the eye care?
It's pretty amazing, yeah. Well, first of all, that instrument that I'm telling you about, the Optos, is wonderful because we can take a picture, a wide view of the back of the eye. There are photos, but this is a mapping of the widest view, which is really good. It makes our life more efficient and better quality, the image quality, and you can get an eye exam very quickly. There's a lot of things that come with that. There's a lot of, it could be like negatives, but I'll touch on that in a little bit, because I believe that might be one of the questions y'all might ask, like, how is it affecting yourself? But I'll address that question in a little bit, but it is changing a whole lot.
In working in construction and welding and all that, and always, a piece of rust from a piece of steel or something get in your eye. Boy, I'm sure you've seen that. I'm sure you have.
It's the tiniest speckle of rust or for debris. And what a lot of times patients, for some reason, it's men wait forever to come in. They'll wait. Oh, I had it since 2 weeks ago, right? And it's something that a lot of times it can be trapped underneath the eyelid. So imagine you have a piece of debris underneath the eyelid, so it acts sort of like a rock beneath the windshield wiper. Every time you blink your eye, it scratches the cornea. Yeah. And then finally they come into the office and they're hurting, they're in a lot of pain, lots of light sensitivity, if not infected, and we can address it. But I suggest if you think you have something in the eye and it's bugging you, come see us. We need to get in there, flip the eyelid, and make sure there's nothing in there, no infections. Especially contact
Never
lenses
saw it
people
that way.
too. People wear contacts, they overwear them. They just overwear them, no matter what. They'll say, oh, I kind of wear them a week longer, and I know it's months and months because they buy the supplies. So.
What do you enjoy most about your profession?
I enjoy giving people their sight. I enjoy helping them see better, and I enjoy addressing issues that will make their vision better. I just like helping people in general. This is a good way to do it.
That's a good feeling.
Yes, it really is. It really is.
Yes.
Does driving this in the sun, would you advise that people use sunglasses?
Absolutely. You got to wear good sunglasses. You got to get the ones, the sunblock, the UVA, UVB. You want to get the good ones because a lot of times people will go into a convenience store and buy should I say, a crappy pair of glasses, right? Oh, they were $10, and they just get them. And all they do is they darken up the light, but they don't protect the UV, and that becomes a problem because imagine this: your eyes, when it's dark, the pupils dilate, right? They get bigger, and when they get bigger, then there's more surface area, right? There's more surface area of the lens to get cataract and damage in the back of the eye, right? So you're thinking of protecting your eyes, but you're actually opening up the pupil and more UV's getting in. So you're blocking the light, but not the UV. So you have to get a good pair of sunglasses, and those are UV labels. A lot of them, the Ray-Ban or the one trusty Ray-Ban, Costa, Maui Jim. There's a bunch of really good ones out there. That's what I recommend.
I imagine you have a lot of people come and see you when there's an eclipse. People.
Oh, big time. Yeah, can I do it? Yes, and afterward I was with you.
Yes.
Not only that, there's people that are just some piece of work.
Don't think.
Something. They're sun gazers, believe it or not. They believe in sun gazing, 100%. They'll say that they're sun gazers, and that's how they get their. And so it's crazy what I see in the office. And then they'll have macular burns the back of their eyes. So,
Oh my goodness.
Don't be doing that. Okay.
Expensive or the sunglasses?
They don't have to be really expensive. Of course, the name brands are a little bit more expensive. I don't sell them.
What do you look for?
Professional service, but if you go like to either online or you go to Walmart or anywhere that sells them, they can easily run in the hundreds to the 300s depending, or more,
Oh my goodness.
depending on the brand. If you want to be bougie, they're really expensive. But a good classic pair of Ray-Bans will do, and they're great.
Does Medicare pay for sunglasses?
I don't think they do. Not
The
Medicare.
prescribed ones?
They prescribe the glasses. Yes.
Now, can you have prescribed glasses and your sunglasses?
You can. Now, they give you an allowance. I know certain insurances will give you a certain allowance, and you can use it however you want to use it.
Well, what about the transition lenses?
Those are a little extra too. Those are the ones that turn from light to dark.
But will they be sufficient to protect your eye?
They can be. The complaint that we have with those is that they're perfect if you're wearing them totally outdoors or totally indoors. When you're in the car, cars and trucks, windshield already has a natural UV protection. And that's how those glasses are activated. The lens is activated through UV. So if you already have the windshield that's protecting, that's blocking UV, they're not going to get very dark in the car.
Right.
That's the only drawback. But if you're outside, they work great. And if you're inside, they work great.
Yes.
Yeah.
Do you wear glasses?
I do both. I do single vision, I have the progressives, the one that change, and right now I'm wearing one contact. I'm wearing one contact because one of my eyes is for distance and the other one is for near. That's called monovision. And that's how I get away from using bifocal contacts.
That's a
Because
thing?
you wear contacts for far away. Once you turn 40, that's a whole nother deal. Because if you're nearsighted, you can take off your glasses and see.
You're so right.
But with them on, you're like, oh. And then if you're farsighted, well, you can't see far, you can't see near, you can't see far. So I need them all the time.
My son called me last week and he said, "Dad, I don't know what's wrong with my eyesight. I'm having a son.
You're
63 years old."
Oh, you're 63, doctor.
You think that's what it is? I said, yeah.
And those patients are the ones that have the hardest time with it because farsighted men usually, they never needed glasses. Their eyes are very strong when they're young, they accommodate, they focus the way they're supposed to. Well, around 40-something, it's almost overnight. The lens, quits the flexibility, you start losing the flexibility. So quits accommodating is the word we use. It's like focusing. So the eye's sort of like a camera. The camera has autofocus all by itself. So it zooms in and zooms out. Well, the eye does that naturally. But when you turn 40-something, that lens loses that flexibility to bend and stretch. So all of a sudden, you start doing this with your arms are long enough, and then you need a bifocus.
Where is your office located?
It is located in the Walmart here in Beeville.
Oh, okay.
And shortly in July, I'll be opening up another office in Calallen. So the Walmart in Calallen, I'll be there 2 days a week. I'll be here 3 days a week. And then I have another associate, Dr. Gama's working Tuesdays and Thursdays here.
In Calana, whereabouts?
At the Walmart.
At the Walmart in
Northwest
Calana,
Boulevard
okay.
and I believe 77.
What advice would you give young people considering a medical career?
Advice I would give them is if they're in high school and they're thinking about something medical and they're not real sure which route to take, start to shadow. I shadow, if you think optometry, shadow, I welcome kids when they wanna come and shadow me. I say, come in for an hour or two, kinda see what I do, not as patients, but just watch what I do. And I'm sure other docs would do the same thing. Go to PAs, go to medical physicians, wherever you, or even if it's not in medical, even if it's like a lawyer or something, go shadow, see what they do, because a lot of times it sounds really good. I'm gonna be a doctor, it's gonna be great, but you don't know. You don't know their schedule. You don't know their day-to-days, what they deal with. Like you have oncologists, which deal, I think is very difficult, with the cancer, all day, every day. Then you have gynecologists, you have podiatrists, cardiologists, right? They all have their thing, right? And I think it's very important to find what you like and what your preferences are and go. That's why they said optometry was a very clean profession for me. I saw the doctors in front of me working. I saw how they lived. I saw how they worked, and I thought, this is exactly what I want to do, and that gave me the inspiration to do what I wanted to do. And let me tell you, it took about 4 years after graduation where I had to figure things out.
Yes.
I had to figure things out. It was very difficult.
Let me mention the sponsors of this show, Luis Serna and son Samuel Jose Taqueria Beata, número 6. Councilman of Ward 4, Ray Garcia and his son, Brian Garcia. My brother, Jerry and Velma Martinez and family of Bayville. Former Commissioner Jerry Rodriguez, a very successful businessman from Goliad County. Michael Monjarras of Cool Breeze. He sold me my unit, he maintains it, and I recommend him to everyone. He does commercial and he does home visits as well. Ernest Garza, our CPA from Corpus Christi, Texas. Thank you all for sponsoring our show.
We're talking to Dr. Elisabeth Aliseda, and she's there at Walmart, eye doctor, and she's always busy. Now she's going to be even busier because she's got another place to go in Calais.
That's right, 2 days a week. 2 days a week. My husband retires and I'm working more.
Qué bonito.
Qué bonito. He told me I was his
He likes
retirement
that.
plan. He goes,
He
"You're my
likes that."
retirement plan.
Let me ask, why is it that Walmart cannot do glasses like my glasses anymore?
I'm not 100% because I'm not sure of the exact policies, as we're completely separate. I believe it's liability. A lot of times if they don't remake the glasses because they don't want to break your glasses and be responsible for that. So I think most of it is more of a liability thing. But if you go to a private optical, a mom and pop shop, you can find someone that'll do that.
Yeah.
I got a question. When they say nearsighted, farsighted, what is that?
What is that? Okay. Nearsighted is exactly what it is. So a lot of people think it's the opposite. If you're nearsighted, you can see near. If you're farsighted, you can see far. But it depends how much, okay? So this is a really cool way to look at it, right?
Okay.
Do y'all remember a long time ago, we were in math class, right? And they showed us this thing called the number line, which is sort of like a ruler, right? You had a 0 in the middle, you had all the negatives on one side and all the positives on the other. The negatives are the nearsighted folks. The positives are the farsighted folks. And the ones that are closest to the middle are 20/20. Okay? So if you're in the middle, you're 20/20. Okay? If you're, and every click, when you go to the eye doctor, you hear them clicking. Click, click, click. Each click is 0.25. I call it, if you think about money, it's 25 cents. Each click is 25 cents. Some people are negative 50 cents. They still see pretty good. Right? They're close to the 20/20, they're close to 0. Right? They're only 2 clicks, right, to the negative. Now, compared to someone who's $6, imagine how many clicks you have to take to get to $6 or $10 or $12, right? Those are very nearsighted, right? So the further out you go, the worse your vision is. That's the exact same thing with the positives. If you're a +1, you're still 20/20. Okay? So that kind of makes sense the further out you go. Now, when you turn 40, that's something else. That's called presbyopia. Okay? So nearsighted is called myopia, and then hyperopia is when you're farsighted. And when your eyes don't adjust anymore, that's called presbyopia.
Someone told me that for example, the back of the eye is like a rubber band. When you're young, it's elastic, and then when you get older, it gets.
Yeah, they're talking about the crystalline lens. That lens that focuses, it's like a rubber band. It stretches and it relaxes, stretches around. And so when you read, it bends. And when you see far, it relaxes, right? And that's what they're talking about, rubber band movement. Yeah, that's
And when it gets older, it don't.
At 40. At 40 something is overnight. I see them all the time. Well, how old are you? I think you're 40 last night.
That's
Yes.
me. That's me.
Or
And,
did
you
not.
know, and they, for me, they say I have a lazy eye.
Okay, that's a whole other thing, right? Some people think lazy eye means that the eye just turns out, and that's the layman's terms for lazy eye. That's actually called
And I notice I'm looking in the mirror and this
one
eye.
eye will go out.
Yeah.
That's called strabismus. That's more muscular. That's a muscular disorder. But true lazy eye is when one eye cannot get corrected to 20/20, no matter what you do, no matter what glasses you put in front of them, it never reaches its 20/20. And that's one thing that a lot of parents that don't know this, they'll have, their kids will have one really good eye. And the mom's like, well, he doesn't need glasses, he sees great. And I'm like, yeah, cover one eye. And then the other eye doesn't see anything at all. So when those kids grow past 7 or 8 years old, that's passing the threshold. So we want to correct that eye, even if it's just one eye, so that it won't become lazy. We want that eye to always receive the stimulation it needs. So that's another reason why parents need to bring their kids, even they're like, oh no, Mio sees good, Mio sees great. Read them anyway. We need to check each eye individually.
Wow.
Very important.
When a child is young and they walk around with one eye closed.
Yeah, they're trying to accommodate. That means something is definitely wrong. Either they're seeing double, or they're accommodating, right? They don't like how the brain doesn't see well with both eyes open, so they themselves will close one eye. Yeah, very interesting. Funny story with my kid. This is my kid, right? They always say the plumber's pipes are always the leaky pipes, right? And
Yeah.
I'm the eye doctor. I have my kiddo. He lives in St. Philip's, and I was one of those moms. Mio sees good. Mio sees good, right?
Como el zapatero.
Oh my gosh! Oh, right. Mio sees good. I go in there. They had a screening. They did a screening, and they said, Dr. Bettis, what? We just want to know, what kind of doctor are you? I said, an optometrist. Why? And they said, well, Ryan flunked his eye vision test. I said, not my kid. Yeah, my kid flunked the eye test.
Optometrist. How do you say it in How do you say it in Spanish?
Optómetra. Doctora de optometría.
Optometría.
Diferente de oftalmólogo. Oftalmólogo hace la cirugía. They do surgery. They operate. They're specialists, right? And we work very close together. I have Victoria, Corpus, even Beeville, and we work together, and I have a very good group where if some emergency were to happen, such as a retinal detachment or something very severe that is out of my scope, I'll take pictures, figure out what it is, and then point them in the right direction. I have the contacts that if I need to, they're very good. I'll call them. It's always Friday, 5 o'clock when this happens. The patient will come in on the last week and everybody's gone. And yeah, so I'll call and they'll say, bring him over, we'll see him tomorrow morning at the hospital, whatever you need. So if there's any doubt in your mind that there's something going on at your vision, you're seeing flashes, you're seeing floaters all of a sudden, a curtain-like appearance happening in your vision, a film, come see me. And if there's anything really serious, I will point you in the right direction.
That's awesome.
Let you know what it is.
Tell me, away from the eyesight now, where did you meet the judge, Jose Aliseda?
Oh, that's a crazy story. That's a crazy story.
I understand you made in a helicopter or somewhere
We
in
got
Vegas.
married. We got married in a helicopter. We did. That's where we set our vows.
Tell us about that.
So he was a very interesting man. I met him, and he's so smart. You all know he's very smart and
Yes, he is.
very well respected. And I've always
Yes, he
liked
is.
that. And he's always, at that time in my life, that's what I wanted in my life. Someone that I could respect and have that, that smartness in my life. I needed somebody that would take care of me in that sense, be able to feel that. And he offered that. He was very good. And we actually met, do y'all know late Mr. Lazenby, correct? Mr. Lazenby?
Yeah.
Bill Lazenby?
Yeah. Mhm.
Okay, so Bill Lazenby actually was the Cupid. So he went and he told, I was working for Dr. Baker, and he passed away. When Dr. Baker passed away, I went and did some relief work to help Joyce, figure out who she was gonna get. And so anyway, I saw Mr. Lazenby, and he went to Jose and said, hey, listen, because Jose asked him, I heard Dr. Baker passed away. He said, hey, what do you have? They have a young doctor, and she's kind of cute. So Jose goes to see who this cute